If you've been dealing with back pain that shoots down your leg, there's a good chance the disc is involved.
Most people assume that means surgery, but usually it doesn't. Let me show you what actually helps.
So spinal decompression uses a computerized table to create negative pressure inside the disc. Think of it like a vacuum drawing displaced disc material back into place, while pulling oxygen and nutrients into the tissue that has been compressed and starved.
Quick myth to clear up. This is not traction. Traction pulls and triggers your muscles to guard against it. Our tables cycle between tension and relaxation in a pattern designed to avoid that reflex entirely. Most patients describe the treatment as really comfortable.
So your spinal discs have no blood supply in adulthood. They stay healthy through movement, through load and release. So you sit all day, you stop moving because it hurts, that exchange will shut down. The disc will dry out, it'll bulge, it'll press on a nerve.
Pain makes you stop moving. Stopping moving weakens the muscles. Weaker muscles put more load on the disc. It's a cycle. Rest gives temporary relief, but doesn't break the cycle. That's what we're here to do.
So before anyone gets on this table, we would need to assess. So your first visit is a real conversation about what your day looks like, what makes it worse, what your actual goal is.
Then we'd run a physical and neurological exam, range of motion, orthopedic stress tests, reflex and sensation checks. Not every radiating leg pain is a disc. Getting that right changes the entire plan.
One more thing I'd like to say clearly, if you were to have progressive leg weakness in both legs, loss of bladder or bowel control, or back pain after a serious trauma, you should go to an emergency room first. We'll tell you when we are not the right call.
If decompression is right for you, here's how care goes. Phase 1 is calming the irritation. Decompression takes pressure off the nerve so your body can start healing. We add cold laser when inflammation needs extra support.
In phase 2, we would start to restore motion. So as the symptoms settle, we would reintroduce movement through adjustments and early rehab exercises.
Phase 3, rebuild capacity. Progressive loading through structured rehab, focused on core and hip control, protecting the disc long term.
In phase 4, we'd return to your life. We would build toward your specific goals and make sure you have the tools to stay there. Most courses of care run 6 to 12 weeks. We would tell you what to expect and when to expect that.
A few tools we bring in when the case calls for it. Cold laser reduces inflammation and supports tissue repair. It's painless, fast, and useful early when pain is high. Shockwave uses acoustic waves to address soft tissue involvement when manual work alone is not getting enough done.
And then we use dry needling to release guard muscles, which would be holding those compensatory patterns in place. We don't use this with every patient, so what you receive is based on what we find, not a preset package.
A case snapshot. A patient came in who was 47 years old, a trail runner, disc herniation at L4, L5 confirmed by MRI, pain radiating to his calf, and he couldn't sit for 20 minutes. By week 2, after starting spinal decompression, pain was dropping and the leg symptoms were pulling back. By week 4, he was sleeping through the night. By week 8, he was back on the trail.
Not a guarantee, but it's a pretty realistic picture of what we see here every day. If any of this sounds familiar, come in, let us assess what is actually going on. We'll be honest with you about whether decompression is correct for your case.
Book online or call us at 303-651-7003. Free patient guide is linked below. No email required.